Hello, this is Petra. I'm a yoga therapist in Berkeley, and this is going to be a video series about mindful movement for the health of your back. There are many factors that influence the health of your back, including how much you move, how much stress you have in your life, what your posture is, and even how you breathe. So I'm going to try to address all those one by one. Today I would like to talk about 3 different kind of movements that are healthy for your spine and for the surrounding muscles to keep them healthy and flexible. It's going to be moving forward and back, sideways, and twisting. Some of these movements are contraindicated in certain conditions, so please talk to your doctor before you attempt any exercise. We're going to start by sitting tall, so grounded through your sitting bones. The pelvis is mildly tilted forward. Shoulders are away from your ears. And if you have that tendency to hunch, try focusing on broadening the collarbones instead of forcing the shoulders back, which might be unnatural for you by now. So nice tall posture, tall spine. And first we're going to move through a series of dynamic movements. That means moving in and out of the pose and then hold the pose once we warmed up the muscles. So let's start with a basic version of the side bend. So we're going to breathe in, lengthen your spine, and then as you exhale, you're going to drop one arm down, including the shoulder, and then inhale back up, exhale down. So let's do it 2 more times each side. Inhale up, exhale down. Inhale up, exhale down. Good. And now let's make it a little harder by lifting one arm overhead. So as we inhale, arm comes overhead, and then we bend sideways, still seated, rounding through the sitting bones. And then again, 3 times each side. So this is 2. And other side. And one last time. Good. You can stop here, or to make it even harder or more challenging is lifting both arms. So breathing out, side bending, breathing in, coming up, breathing out, and then again 2 more times. Breathing deeply, and one last time. Good. And then relax your arms. And then let's try to hold the side bend for 3 deep breaths. So inhaling, and then hold. Try to send the breath into the side body, which will intensify the stretch a little. So 3 deep breaths. And then back to center and repeat on the other side. Watch for your shoulder, relax this bottom shoulder. Deep breath, and then come back up. All right, so now that we've done a side bending, let's do some twisting. So with twisting, we always want to make sure that we lengthen first before we move into the twist. So breathe in, arms up, lengthen your spine, and then as you exhale, rotate to the right, touch the opposite knee, and then back to center, and twist to the other side. Inhale up, and twist. Make sure you're not forward bending or back bending, so the body is upright. Good. And then one more time. Exhaling, inhaling, and exhaling. Good, and then the next one, we're going to hold the pose. So again, twisting to the right. Your left hand is touching your right knee. And then you're lengthening up on every inhale and exhaling and maybe moving a little deeper into the pose. But listen to your body, don't force it. Again, staying 3 or 4 breaths and paying attention to the sensations you're feeling around your back, around your waist, but upper back too, and shoulders. And then release, and let's repeat on the other side. So inhaling, lengthening, exhaling, maybe moving deeper, and try to distribute the twist along the whole back. So upper back also twists. And then back to center. Again, take a moment to feel any new sensations you might be having in your back right now. Take a few deep breaths. And now we're going to be moving forward and back. So with forward bend, it's very important that you bend at the hips, not at the waist. So I'm going to show you from this side. So bending at the hips means you're going to allow the pelvis to tilt forward slightly, your back stays straight, and you're bending forward. You can use your arms to support your body, and you're engaging the core, so pressing the navel towards the spine. What you don't want to do is hinging at the waist. Then what happens is this. So see, my back is really rounded, and that's not healthy for your spine, for your vertebrae. So once again, we try to allow the pelvis to tilt forward, and it might not be so easy if you're not accustomed to this type of movement, and if your hamstrings are too tight. So let's work on that. Tilting forward and then bending forward and coming back up. And then let's try to do a back bend. So for the start, we can use the hands for support. So place your hands on your low back, and then you're gonna inhale, lift the chest, look up at the ceiling, and back bend, shoulders back. And then exhale, come through the neutral position, and then hinge at the hips and bend forward. And then inhale, use the hands if you'd like, lift the chest and back bend. And then come back to neutral position and bend forward. And one more time. And back. Okay. If you'd like to do it, if you'd like to make it a little bit more challenging, lift both arms up as you back bend, but still keep focusing on lifting the chest up. And then exhaling. You can touch the ground if you like. And inhaling, lifting the chest, looking up. And exhale. And one more time. Inhale. And exhale. And then you can stay here for a while. Let your head hang. Shoulders are relaxed. Take some deep breaths. And then when you're ready, press the navel towards the spine as you come up, straight back. And that's it for today. I hope you enjoy this little practice. And try to do some movement for your spine every day. Namaste.